is one of the lowest in the world, even though Japan has the higher elderly population as a risk factor for the COVID-19. And as Australia also, overall, we can say that Australia can manage this pandemic well, even though they still have a hard battle in the Victoria State. Yeah, but when we talk about COVID-19, it is not only about the health problem, but it is also impact all aspects of our life as a human, as a society, and also a country. So this is, will become our focus discussion today. So before we invite our speaker to deliver the lectures, I would like to invite Prof. Nasrum Masih, the Vice Rector of Innovation, Research and Partnership at the Hasanuddin University, on behalf of Rector Unhas to deliver the opening speech. Prof. Nasrum, maybe Prof. Nasrum is not with us yet. So okay, maybe we will give Prof. Nasrum later a chance to giving a speech. And today we will have two sessions. The first session is a lecture session from our speakers, and the next session is a discussion. So if you have a question or comment during this speech, please post it in the chat room, and then we will convey later to in the discussion to the speakers. So okay, maybe we will go directly to the lecturer, to the speaker. So before the lecture, I would like to make a short introduction about our speakers this afternoon. The first speaker is Professor Anu Ramohan. She is the professor of economics and the Associate Dean International for the Faculty of Arts, Business, Law, and Education at the University of Western Australia. She is also a senior fellow in the Australia-Indonesia Center, and her research is focused mostly on understanding the relation of socioeconomic and health that can influence maternal child health, gender, and food security. His focused research particularly in India, Indonesia, and also in Myanmar. And the next speaker is will be Professor Takuro Furusawa. Professor Takuro Furusawa is a professor at the Graduate School of Asian and African Area Studies, Kyoto University, Japan. His research interests include human ecology, global health, and Southeast Asia area study. Professor Furusawa is also a medical doctor, and then he is a new college for us in Hasanuddin University. He first visited UNHAS in 2011, and since then we have several collaboration together with the UNHAS scientists and UNHAS scholar. And our discussion is Sudirman Nasir. He is a lecturer at the Faculty of Public Health, Hasanuddin University, and also a senior fellow in the Australia-Indonesia Center. So I think this is enough for the brief introduction. I want to invite the first speaker, Prof. Anu Ramohan, to deliver the lectures. Your time is 20 minutes, Prof. Anu. Okay.
Thank you very much, Pak, for introducing me. Can I please share my screen?
You can directly share your screen because we already make you a co-host.
Okay. Okay. Thank you very much for inviting me to give this lecture. It's a great honor. So I'm just going to talk a little bit about Australia's COVID experience, but I'll touch upon Australia's experience mainly from an economic perspective and the fact that we have low case numbers. So to begin with, Park, you already talked about this. As you can see from this graph, the COVID pandemic is obviously a big major shock to the global economy, and it has disrupted all our health systems and also our labor markets. And nearly every country in the world has been affected. But as we can see from this graph, we see that Australia and also Japan have not been affected as badly as other countries like the United States, Brazil, and India. And we see down here that Indonesia and the Philippines have also been affected, but not as bad as um, our neighbors in India and the US, which is so. If you look at the Australian experience, so the first Australian case that we had was in late January when we had a return traveler from Wuhan in China. So at that time, we didn't realize that the situation would become this bad. But the Australian federal government introduced border closures for everyone coming in from China other than Australian citizens. So in the first week of February, Australia introduced border closures for anyone coming from China. So, and then what we saw here, we see that the case numbers start to spike. And this was because people were not coming at that point just from China, and they were overseas return travelers from other parts of the world that were also had high COVID cases, like the United States, Italy, and at that point also from Singapore. So what we see here then that in March when the cases started to increase, and at that point most of them were overseas return travelers, the Australian government stepped in and introduced border closures for citizens from all the countries. So no one could enter Australia except Australian citizens. And Australian citizens were also not allowed to leave the country without getting an exemption. So the first thing we did was the federal government introduced border closures. And then what we also saw in Australia is at that point, we also saw that individual state governments introduced border closures for their own states. So for example, we are in the state of Western Australia, and no one from outside Western Australia can enter this state without an exemption. And we can't leave the state without an exemption. So that was the first travel related bans that were put in place. The other thing that the government did was they introduced social welfare measures to deal with people that lost their jobs and industries that were closed. I'll talk about that in a minute. So what we see here is if you look at confirmed cases in Australia, as you rightly pointed out, we have very low cases, but we see that the cases in the state of Victoria have increased quite dramatically in about June. So again, going back to this chart, we see that numbers started to decrease quite dramatically and then have increased, but most of the increase is happening in Victoria. And the problem at this stage was that up until this point, we were not that worried because we thought that all the cases coming in were mainly coming from overseas travelers in cruise ships. And for them, we put them in hotel quarantine for 2 weeks and at the government expense. But what we see here in Victoria is around June, there were some breaches in the hotel quarantine. So some of the security guards or the people working in the hotels contracted COVID and took it back to their families. So that's how we then see that there is a start of community transmission in Australia. But because our borders were closed in Western Australia, in Tasmania, and in the Northern Territory and South Australia, we saw that these states had very low incidence of COVID. But because New South Wales shares a border with Victoria and there was no border closure there, we see that some of the COVID cases did escape from um, Victoria. So if you look then at COVID cases by source of infection, we see that with the exception of Victoria, where most of the cases now are community transmitted, but we don't know the source. And they are putting efforts towards contract tracing. We see that in all the other areas, most of it are basically travelers, Australian citizens who have returned, who are in quarantine, so they are not actually spreading it in the communities. So the main problem that we've had in Australia in terms of deaths have been that most of the deaths have been concentrated in aged care homes and nursing homes. And these are elderly people that typically have comorbidities. So again, what is happening is people in the aged care homes, the workers are possibly, the source of the transmission, but most of our deaths are happening among very elderly people in the 80s and 90s, not so much in the young population. And again, you can see that most of the deaths are concentrated in two states. So what did the government do in terms of economic stimulus packages? So the first thing, the government closed the borders, and they also shut down many sectors, like they closed down restaurants, pubs, clubs, they shut down music venues, they shut down um, sporting activities, and so many workers lost their jobs. So to deal with this, the government introduced what we call the JobKeeper payment. So the businesses that lost more than 30% of their revenue were able to access government subsidy if they kept the worker in the job. So for example, the tourism sector was very badly affected in Australia. Retail sector, international education was affected. But to be able to access the JobKeeper payment, the business had to be a small business like a restaurant or something like that. Industries like the universities were not able to access the JobKeeper payment because we are so big. International students our revenue fell, but not by 30%. So the big airlines, our Qantas was affected, our national airline was affected because more than 20,000 Qantas employees lost their jobs. So the JobKeeper payment is a way of giving the people that lost their jobs a supplement of 1,500 per fortnight, which is Australian dollars, for up to 6 months. So this was introduced in March, and it was supposed to be till the end of September. But in July, the government announced an extension of this program to be till the end of March. So the government is providing income supplement to those workers that lost their jobs. And so this is just a JobKeeper allowance. In addition to that, we have another allowance called the Job Seeker allowance. This is for businesses that are completely shut down. So they have no prospect of opening up. So these workers cannot go back to the jobs that they lost. So the Job Seeker is for people that are not going to be able to go back to their jobs. It's just a income supplement that we have, like unemployment benefits. So we see that JobKeeper was a big proportion of the government support. In addition, they increased social assistance programs. This was at the federal government level for all the states. And they also allowed people to have early access to their superannuation or their pension entitlements. So because most of the sectors that were affected were young people, they were able to withdraw up to $10,000 from their pension accounts. This was simply done so that people were able to have a way of paying their mortgage or their rents. In addition to these government supports, from an economic perspective, initially when we had the first wave of COVID, our supply chain was disrupted because we were so reliant on China for PPE equipment, masks, and so on. We didn't have enough supplies. So, and the other thing the government did was we set up a national stockpile and we increased our capacity for ICU. We introduced, we sought and got, now we've got capacity for 7,000 ventilators. We have ordered 220 million masks. So in Victoria, for example, they made it mandatory for people to wear masks if they were to go out. And the government supplied free masks for health workers or workers in vulnerable occupations. Additionally, about 15 to 16,000 nurses were trained to work in ICU units. So what we did was, in addition to these economic supplements to help the people with who lost their jobs, the government at the federal level also made a lot of effort to help with the health related aspects, and they also supplied what we call the Australian Defence Force to help to ensure that people were compliant with social distancing and so on. So this was done at the federal level. Individual states, because we closed the borders, have their own different rules. So for example, I'm sitting here in Perth in Western Australia, which is completely COVID-free at the moment. We are free to go where we like. There's very little social distancing, except there are some social distancing venues on venues, but our university has opened. Students can come back onto campus. Movie theaters are open. Life is almost back to normal here, I would say. So then turning to the economic impacts of COVID, finally, what we see is that, of course, Australia is emerging from the pandemic a lot sooner than we expected and at significantly less economic costs than we expected. But what we see is that the unemployment rate in the country has gone up quite a lot, and we have a huge debt, national debt. So unemployment is anticipated to increase till up to 10%. And Australia has, entered into a recession, which is our first technical one since 1991. And the closure of international borders is affecting Australia quite badly, and particularly in the tourism and education sectors. And the sectors that were most affected in the first wave were hospitality, like cafes, restaurants, and so on, because they were only allowed to have takeaways. And then air travel, tourism, creative arts, entertainment. And that is now having a flow-on effect on the manufacturing sector. Australia didn't have a big manufacturing sector, but it's having a flow-on effect on construction and supply chain. So I would say that Australia has managed the crisis relatively well, but the big challenges we face now is, how do we open the economy? How do we open the states are having discussions where it's become a bit political, where they are not prepared to open the economy or open the borders. So how do we safely open the borders in a way that's not leading to health effects? I think with that, I might just stop here, Mark. Thank you.
Okay, thank you very much, Prof. Anu. Very insightful presentations. I think all the countries in the world also face the same problems, raising the question how they open the economy, how they open the state. And then I think this is very interesting. Then maybe I will go first to the next speaker, so we can get like a whole perspective here. So I will invite Prof. Furusawa to deliver the lectures. Your time is 20 minutes, Prof.
Yes, thank you very much. Yeah, first of all, I would like to, it is my great pleasure to deliver my talk through Zoom today. And yeah, I would like to thank organizers. Yeah, sorry to say, I misunderstood the invitations and I prepared 30 minutes presentation. So, but yeah, I will skip some of my contents. So yeah, let me share my, okay, can you see my PowerPoint slide?
Yes.
Yeah,
Yes,
okay.
sir.
Yeah, so I titled my presentation as Science, Policy, and Society of Japan under the COVID-19 pandemic. Yeah, so yeah, first of all, I would like to clarify my position. So I am neither involved in Japanese policy or strategies against the COVID-19, nor as a specialist on the COVID-19. So my aim is to share information about the general situation of the COVID-19 in Japan and to provide information for us to think what we can learn from its pandemic. In the beginning, I talk about the time series trend in Japan. So this slide shows the number of positive cases per day with dates of important political changes. So first case was identified on January 16, and the first death was confirmed on February 13. Then the number of positive cases gradually increased. On February 27, Prime Minister Abe requested all primary, secondary, high schools to close their class voluntarily. After a few weeks, the number of cases gradually decreased. At that time, we called this small peak as the first wave of because we did not know what would happen in next weeks. On March 7, local and central government started to require people to avoid 3 Cs, that is avoiding gathering people in closed environment. Until this time, Japanese strategy looked successful. However, in March, huge number of Japanese who study abroad or work abroad returned to Japan because other countries started to lock airports. Among the huge number of people returned, a lot of infected individuals are also returned. We did not recognize that the situation of Italy or other European countries are so bad at that moment. After a number of positive people returned into Japan, the real first wave started. As a dramatic increase of positive cases in Tokyo, Governor of Tokyo Metropolitan City, Metropolis Yuriko Koike requested jishuku in Japanese, jishuku of people. That means stay home voluntarily. On April 7, Prime Minister Abe declared the state of emergency in Tokyo and 6 prefectures. This state of emergency expanded to all Japan on April 16. The positive case then dramatically decreased, and the state of emergency left until lived on May 25. Then politicians started to use such terms as new normal or with corona. These words reflected that we needed to normalize economy by going back to the normal life, while the coronavirus is not totally eliminated. Then after a few weeks after we began to live new normal life, the positive cases started to increase again. So this is the start of a second wave. However, political responses were minimal for this second wave. No state of emergency anymore. Even on July 22nd, government started economic stimulus package called Go to Travel. In this package, government financially support people's domestic travels to help economy of tourism, restaurant, and others. So after this, infection expanded more and more. However, the peak was achieved in the end of July to the beginning of August, and the patient decreased day by day until today. So this is the general situation. And you may wonder why the government do not declare a state of emergency nor took strong actions for today, for second wave. So this slide shows the number of PCR tests per day. After the expansion, the equipment and technicians for PCR tests were prepared. Actually, in February, March, April, the epidemic was beyond the capacity of PCR tests in Japan. After the end of first wave, the PCR test capacity was raised. Therefore, a much larger number of PCR tests are performed today. And this is a reason behind the increase of positive cases. This slide shows the number of deaths because of the COVID-19. As you see, the number of deaths are not so large today. The peak is lower in the second wave than first wave. There are two reasons. One is the medical capacity was raised today. And the other is more cases of younger generations with no symptom or with asymptomatic are also included in the patient. So this low mortality reassures us. So next, I introduced a preparedness in Japan. Actually, Japan did not predict the COVID-19, but predicted the pandemic of the novel influenza. There are act of special measures for pandemic influenza and new infectious diseases preparedness and response was approved by the Diet and issued in 2012. So this law was revised in this year to adapt the COVID-19. So among a lot of strategies related to this law, I explain one figure in materials of cabinet decision in 2013, 7 years ago. This figure shows concept of Japanese responses to the novel influenza and also the COVID-19. So in this graph, y-axis is for the number of patients and x for time. As the nature of infectious diseases, the patients increase geometrically and achieve the peak and then decrease according to time. But there is a limit of medical capacity. If the number of patients exceeds this limit, medical services or medical system itself collapse. If the collapse of medical services happen, the situation is uncontrollable, as in case in Italy, USA, and probably in Indonesia. So therefore, strategy is how the geometrical increase is suppressed under human control. So one is border protection to make entrance of the virus delay and make the transmission delay. So this is earning time strategy. So during the earning time, medical capacity is to be raised. On the other hand, several measures are also taken to make the peak delay and low. So in this strategy, even if the patients increase geometrically, the situation is under human control. So that is why still Japanese government believes our situation is under control. And these posters represent Japanese strategy not only for the COVID-19, but also influenza and other common infectious diseases, coughing manner and wearing a mask in order not to transmit the virus to others, and washing hands to avoid infections. So this is just a daily customs, but these customs are very common in Japan even before the COVID-19 because we have been familiar with the influenza and other virus infections. So next, I talk about unique stories for the COVID-19 epidemic in Japan. So it was interesting that scientists, especially epidemiologists, became popular in Japan. Professor Ostani, Professor Nishiura, and Dr. Omi are the most popular scientists today. Actually, this photo was cited from a special issue of Japanese media named Bungei Shunju, saying fate of Japan was entrusted on 3 researchers. I especially would like to introduce Professor Nishiura. Now he is at Kyoto University. I introduce him as my respect because he is young and the same generation with me. He has been the world-leading epidemiologist and genius of mathematical modeling. He unintentionally became popular as a scientist in front of public communication. He issued important warning messages to the public through the government, press conference, SNS, and others in his sense of mission to stop the COVID-19. So by these scientists, a number of facts are scientifically found, and those findings were integrated into Japanese policy. So this is about the unique characteristic transmission pattern. The left side is an example of influenza and other common infectious diseases. In this case, the virus is transmitted from one patient to 2 or more individuals continuously, one to others. However, the researchers found that COVID-19 is different. Only 1 in 5 patients, regardless of severity, established transmission to other individuals. In only some cases, the transmission was made to a number of individuals. In this figure, this patient transmitted to 5 others. But among the 5, these 4 did not transmit it to any more. Only 1 transmitted to another 1. Then this person also transmitted to only 1 person. But this person transmitted to 5 others. So this, in some cases, this happened, but most cases, transmission was not established. So this finding suggested how important to control the cluster and the effect of cases others, and cluster. The effect of cases other than cluster is less influential. So another scientific strategy is cluster tracing or contact tracing. So surveys in many countries can be called as prospective strategies. If you find positive case, health officials will trace those who are contacted by the case and monitor occurrence of further infections afterwards. This is prospective strategy. However, survey in Japan is called retrospective strategy. In this case, if you find the positive case, the health officials will trace back the activities of the patient and identify the place where the transmission happened. So not trace forward, but trace backward where the transmission happened. So maybe in some cases, another patients are also be back to the same place of infections. Once the place where the transmission happens, so the health officer will identify the place of the cluster. Once the place was identified, the health officer will contact and perform the PCR test of those who were in the same place, regardless whether other individual had a symptom or not. So through these scientific studies, 3 Cs strategy was taken. Professor Nishiura and others found that transmission in closed environment are much more different from other cases. In this figure, published in their papers, shows that in other cases, patients, so darker color represent cases in closed environment, and blank one represent other cases. So in other cases, the patient transmitted to almost zero, so no transmission to others, or 1. However, in closed environment, the transmission was made to 1, 2, 3, 4, 9, or even 12. So based on this finding, the 3 Cs strategy was issued. So avoid 3 Cs: closed spaces with poor ventilation, crowded places with many people nearby, close contact settings such as close friend conversations. Professor Nishiura also made important calculation. He called himself as Hachiwari Ojisan, literally meaning 80% middle-aged man. So he insisted that 80% reduction of human-to-human contact will terminate the COVID-19 epidemic in Japan soon. So this is a result of his mathematical calculation. And following his, after he encouraged to reduce 80% reduction of human contact, many measures are taken. So this is one example that a private company, a group, issued based on their big data analysis of flow of smartphones. These companies provide us every day about how much percent of human contact reduced. So this graph shows the human flow in Shibuya Center Gai, the most crowded place in Japan. Actually, when the time during the state of emergency, the human flow in Shibuya was actually reduced to about 20% before the emergency period. But from here, I would like to introduce some experience of people in society Japan. So first of all, the state of emergency of Japan was much different from other countries. Many countries used legal force to reinforce lockdown, but the Japanese government did not make law of such legal force because of our regret to militarism in World War II. Japanese have allergy about the situation that the government has strong power to restrict human rights or restrict human daily lives. Constitution of Japan also restricts the power of the government. So that therefore Japanese state of emergency was made without lockdown or legal force. So everything was made citizens voluntarily and according to only request by the government. So this news article written by Dennis Noel in Science best describes the Japanese situation, I think. Yeah, I will read this article. So with this Japanese approach, we were able to control this infection trend in just 1.5 months. I think this has shown the power of the Japanese model. Prime Minister Shinzo Abe declared at a press conference yesterday evening announcing the lift of the state of emergency. Japan's national and local governments do not have the legal power to impose lockdown measures, but authorities urged people to stay home as much as possible. Companies still allow working from home, and bars and restaurants to close or serve only takeout. Based on modeling, members of the advisory committee urged people to reduce their interactions with others by 80% in order to bend the curve. So this article was issued after the first wave, so this didn't reflect the second wave, but the situation is, yeah. So here I want to share some of my photos. So this is the photo taken during the state of emergency in my home. So Zoom lecture became popular. Primary school rented PC for each pupil. My children took a course through the PC. So this photo is taken when I delivered the Zoom lecture. I made Zoom lecture in a very small terrace of my apartment room because the housing environment of Japan is bad. But because my room was occupied by two monsters during the school closure, so I had no place in my home, so I was allowed only in the terrace. But now life is recovered, children can play football. So during this period, Japan, jishuku is become popular term in Japan. So jishuku is Japanese concept, Japanese mentality, and difficult to be translated into English, but it can be said as self-restraint or restrain myself or yourself. So jishuku of going out is to restrain myself to go out voluntarily. So jishuku of celebration, jishuku of travel, jishuku of meeting friends, jishuku of homecoming, jishuku of even meeting old parents. So yeah, because as I said, government has no legal force, so everything was made by people's voluntarily. So jishuku was made people's own responsibility. And another term become common in Japan is docho atsuryoku. It is also Japanese mentality term, but can be translated as peer pressure or pressure to conform. So this is a news article published in Asahi Shimbun, one of the biggest newspapers in Japan, titled as Wartime Japan and COVID-19 Conformity offer some parallels. So I will read this article. The Japanese society since ancient time has relied on what is often disparagingly referred to as a nation's group mentality to maintain order, as any scholars will attest. But there are also strong echoes in the Japanese society functions today, noted writer and theoretical director Shoji Kokami said. Strong peer pressure arose once the general mood in society was one of suicide missions as the only way to protect Japan. He said, likening that to the current situation over the novel coronavirus pandemic that led public officials to call on the public to refrain from non-essential outings and businesses being asked to close their doors. Suicide mission here means a notorious kamikaze attack during World War II, when many young people made a suicide attack against the United Nations. So businesses, yeah, back to the article. So businesses that continued opening were targeted for criticism over social media, Kokami said. He added that the Japanese-style organization and society has always had a violent side that sought to survive by consuming the lives and happiness of each individual member. And also, I want to introduce another aspect. So this photo is from one website of Japanese TV station. Unnatural is Japanese television drama on TBS starring Satomi Ishihara. I introduced this drama not only because I'm Satomi's fan, but also this drama reflected some Japanese mentality. So episode 1 was titled as Nameless Poison, solves the mystery of continuous unnatural death. So in this story, the scientific investigation disclosed that the unnatural deaths were caused not by serial killer, but by spread of the novel coronavirus in Japan. So in this drama, coughing manner, washing hands, wearing masks are encouraged, so cluster transmission, retrospective tracing strategy, office closure are described. And also this drama described this epidemic induced panic of the society, and the patients and the families are targeted for criticism. and discrimination. But this drama was on air on January 12, 2018. So already 2 years ago. So there are some, so this drama already predicted Japanese mentalities, what will happen when this pandemic comes. So finally, I want to share some, is it okay?
Kurosawa Sensei, your time is 5 minutes left. Okay.
Yeah, sorry, I made, how many minutes left?
5 minutes.
5 minutes left. Oh yeah, okay, thank you. Yeah, I think I can complete my talk. So yeah, finally, I want to share some, add some information from historical perspective. So needless to say, all germs originated in nature. This is biological or ecological mechanism. So in January, Chinese team identified that the COVID-19 originated from bat. Other studies suggested other animals, but anyway, this virus is from wild animals. As in review written by Wolf and others in 2007, germs such as rabies, Ebola, dengue, HIV, all are from wild animals. So differences was in the way of transmission and the evolution of the germs. But the transmission is made outside of nature. For example, HIV was spread to the world from the forest of Africa through global network of transportation. And COVID-19 expanded in urban environment such as sports gym, live music club, karaoke. So these are transmission, pandemic was happened in such an artificial environment. And I also introduced one that internationalization is countermeasure against pandemic. So one example is smallpox. Smallpox virus is only one germ eradicated from the world in 1980. So effectiveness of variation, that immunization with materials taken from patient, human patient, known in ancient Indian medicine and traditional Chinese medicine. And the record of first variation in 18th century in Japan is learned from China, but this showed limited effectiveness and has strong side effects. But the first vaccine made from bovine sample was developed first in human history by Edward Jenner in Britain in 1696. And von Siebold introduced a vaccine to Japan in 1823 by importing it from Batavia, Indonesia. So that the vaccine was developed in Britain, and German and Dutch doctor introduced the new vaccine from Indonesia to Japan until 19th century. So then later mass vaccination law was built in Japan and continued until 1976, but in 1980s, smallpox eradicated. But globalization, internationalization overcame the pandemic. And now all of the airports are closed, but we need to note that opposite word of internationalization is nationalization. So we need to avoid nationalization of Japan and all countries. So freedom of internationalization. So in 1615, Sultan Alauddin, grandfather of Sultan Hassanuddin, told to Dutch Brioche against request of their monopoly trade. He said, "My land is open to all nations. God has made the earth and the sea, and has divided the earth among men, and given the sea in common to all." And decades later, Sultan Hassanuddin told so that all mankind could have the enjoyment. So even Kingdom of Goa lost, but the spirit of freedom has survived in Makassar. So Unhas's anniversary can be Memorial Day for next generation world with freedom and unite again after the COVID-19. Yeah, so I hope we can keep collaboration. Selamat atas Dies Natalis 64 Universitas Hasanuddin. Terima kasih.
Okay, thank you very much, Prof. Furusawa, and this is very interesting lectures. It's cover all the aspect in the Hasanuddin in the COVID-19 pandemic in Japan. And before we move to the discussion session, we will ask Sudirman Nasir first to give us some insight, the Indonesian perspective of this COVID-19 pandemic. Maybe your time is around 10 to 15 minutes, Pak Sudirman, so please. Okay. So the host, can you unmute Pak Sudirman, please? Not yet.
Okay. Yeah. Thank you. Okay. Thank you, Dr. Joko, and also Professor Ramohan and Professor Furusawa. Both colleagues who are working very closely with Hasanuddin University in various research collaboration in the last few years. My role as a discussant is to re-emphasize some key points and also trying to contextualize the lesson learned from Australia and Japan in the context of Indonesia. And I will try my best to make it as briefly as possible. One keywords that I think appear very strongly from both Furusawa and Ramohan's presentations this afternoon is the state capacity. Both Australia and Japan demonstrate a stronger state capacity in dealing with the pandemic and also in mitigating the impacts or various consequences of the pandemic, either in health or in socioeconomic aspects. And this state capacity also differentiate both countries compared to Indonesia. Both countries respond much earlier than Indonesia and also invest in health sector much higher compared to Indonesia, including in preventative medicine. Professor Ramohan also briefly mentioned about comorbidities. They play a key role in facilitating the fatality rate related to COVID-19. And in this comorbidities aspect, we can also see the different level of investment in comorbidities management between Australia and Japan in the one hand and Indonesia in the other hand. Even compared to some neighboring countries in Southeast Asia, Indonesia's investment per capita to health is actually much lower compared to neighboring countries such as Thailand and Malaysia. And it is lower in terms of preventative medicine or preventative measures. They actually play a key role in managing comorbidities. Many of them are non-communicable diseases such as heart diseases or diabetes mellitus, and also managing risk factors such as hypertension and obesity. I know that both Australia and Japan invest a lot in managing these non-communicable diseases in the last 20 years. And now they start to enjoy the benefits of investing in these preventative measures. Prof. Ramohan also emphasized the state capacity to address economic aspects of COVID-19 in Australia, especially in economic sector. And we are witnessing now how Indonesia's government is struggling to provide that kind of economic mitigation. Indonesia's position as a middle income countries, of course, are much different compared to state capacity of Australia and Japan. Another factor that also important is what Professor Furusawa mentioned as a science-informed decision making. Both Japan and Australia also now enjoy or harvest the benefits of investment in science ecosystem that now play a vital role in both testing, detecting, and also managing the patients living with COVID-19. And we start to see how investment into sectors strengthening the health system and also strengthening the science ecosystem are the common characteristic that enable some countries, including Australia and Japan, and other countries such as Germany, Scandinavian countries, or other countries in East Asia, such as Taiwan and South Korea, that enable them to manage the pandemic and the consequences of the pandemic relatively well. One last important aspect that I would like to re-emphasize as a discussion this morning is society's capacity to respond. In the latter phase of Professor Furusawa's presentation, we have some opportunities or window to peep into the fabric or the nature of Japanese society in responding to the pandemic and to the government's policy, such as physical or social distancing and large scale of social restrictions at the peak of the pandemic. Pressure to conform as one very important aspect of Japanese society is also demonstrated as a vital role in managing the impacts of the pandemic. And both Australia and Japan also now see the benefits of investing in the so-called preventative culture or safety culture by most society that enable them to mitigate the effects of the pandemic. This kind of investment is very strategic and need to be done sufficiently and in a continuous way before we can enjoy the benefits. And one last thing is political unity that demonstrated by governments in both countries at national and subnational level. We can see that in Australia, not only federal government that play a vital role in managing the COVID-19, but also the state government or city government, as well as demonstrated in Japan. So those aspects, such as state capacity, science-informed decision-making, societal capacity to face a big shock or big crisis such as COVID-19, as well as safety culture or preventative culture that long-rooted in the social structure of society in both cities, I think also play important role that enable both countries to perform relatively well. A lesson learned that we in Indonesia should learn. Before closing my discussion, one thing that I would like to share is not all responses in Indonesia are doomed. We start to see some improved programs from the government, and one also a strong indication for our responses is actually community responses in the form of social solidarity. Even though we are also facing some part of the society who show a low adherence to governments or to the public health authorities' encouragement to employ safer behavior. So there are a lot of things to learn from each other, and as Takuro Furusawa mentioned in the last slide, that the world or the countries in the region should unite and work together to tackle these multifacets of crisis in the form of COVID-19 pandemic. That's my brief discussion, Dr. Joko, and perhaps we can follow it up through discussion with the audience.
Thank you very much for Dr. Sudirman. And then I think, yeah, one of the main prominent thing is the capacity of the country, the capacity of society, yes, on how we manage this pandemic. So before I have several questions here for Professor Furusawa and Professor Anu, and then maybe I will read some of the question. The first question maybe from let me from Dr. Lily Ishak from Ternate, North Maluku. I think this is a nice question. How this country, Australia and Japan, manage their community in relation to educational activities at school and universities? Maybe this is for the both speakers, and I will add the second question, maybe regarding the vaccination. I mean, yes, until we have the vaccination, maybe we have still to stay with the non-pharmacologic approach, social distancing and contact tracing and etc. So this is from Triana from Kyoto. He wants to know the progress of vaccination development in Japan and Australia, and do you think the world will be back to the true normal after the vaccine arrives? I think this is for the both speakers. Maybe this is for the first two questions for Prof. Anu and Prof. Furusawa. Maybe I will go first to Prof. Anu. So, okay. Prof. Anu, please.
Thank you for the questions. It's good questions. With regard to, I'll answer the first one with regard to education. Like I said before, each state in Australia has a different policy. The school children have by and large been allowed to go back to schools in all the states except Victoria. And for the universities, what has happened is the university students, the international students are not able to come back to Australia. So what we have done is we've put online education for them. And our students, because of social distancing requirements, are not able to all be accommodated in our lecture theatres. So what we've done is all our classes are online, but for smaller classes, at least in WA, we are allowing students to come back onto campus. So, but school children have always been allowed to go back to schools. So that's not for, there's been very little transmission from schools. So is that okay? So with regard to this second question, shall I just answer it also?
Okay.
Yeah.
Please.
So with regard to the second question about whether world will go back to where we were once the vaccination is found, I think it's hard to tell at this point because we don't know what the implications are. We don't know what the health, it's too short period to know what the side effects are of COVID. We are hearing cases of people contracting COVID even after they've recovered. So hopefully we find a vaccine. We can just hope that we find a vaccine that will allow us to go back to where we were. But I feel that people might be a bit more worried about going back to where we were. And for many people who've lost their jobs, it'll be very difficult to get back to, especially airline industry. And those, I think it'll be difficult, but we can only hope. Yeah, thank you.
Okay, thank you very much, Prof. Anu. And then maybe we also want to hear the Japan's perspective on this question. So for Professor Furusawa.
Yes, thank you for good questions. And about first question about education in Japan. So about primary, secondary, and high schools. So actually, the school closed about 1.5 months in February, March, and April. But there are some vacations in spring. But actually, the start of the school delayed. But usually, those pupils have their summer vacation period. So the beginning of school delayed, but the pupils lost their summer vacation. But the delay was minimum. And also, even under the state of emergency, as I showed my photos, so children can have the course through Zoom. So yeah, so from June, I think from the beginning of June or in the middle of May, all schools are returned to normal. And now all children can go to school. But the situation of the university is not so good. Yeah, actually, all these schools, children can go to school and all adults can go to offices. But university is locked because in Japan, about some millions of university students, and if they move to university, that may cause new expansion of transmission, so that rural local government do not wish to that university start. But recently, but under this situation, so the university students are very, how to say, under not good condition, because university students, when they graduated from high school, they have no celebration because of the COVID-19, and they had no time to say farewell to their friends in their home. But after they enter to university, the university campus is locked down. No class in the real classroom. They receive only lectures through Zoom or through online. They live alone in their rented apartment house. So I think so now their how to say mental health condition is very worried. And there is a new Japanese term called corona utsu. Corona utsu literally meaning corona depression. So there are depression, mental disorders this is increasing among university students. And the situation is same about international students as in Australia. So no international students cannot come to Japan or go back to their nations. And yeah, I myself is feeling very how to say sorry about Ibu Toriana. So she is studying in Kyoto now, and so yeah, I think she wants to meet her parents in Indonesia, but she cannot go back to Indonesia under this situation. So she live in Kyoto, even in this situation. Yeah, so that is situation about education in Japan. And the second question about vaccination is, yeah, as you know, say usually it will take 10 years or more to develop vaccines. However, many countries and many pharmaceutical companies are now trying to develop the vaccine. And actually, so some of the companies in Japan is also trying to develop, but the pharmaceutical companies in Japan is not so strong in the world. So the vaccination development in Japan is so delayed. So I think the leading companies are in UK and United States. So Japan government of Japan has making negotiations to purchase the vaccine from those companies in UK or US. Yeah, because one special situation of Japan is, yeah, if there is no COVID-19, so we have the Olympic and Paralympic Games in this year in Tokyo, Japan, but this was postponed to next year. So government of Japan really wants to make the Olympic Games next year. So I think government will try their best to prepare vaccines and make the situation back to true normal life. But I myself is not so optimistic about this situation. Yeah, we have no material to predict when our life can be back to true normal. But yeah, I cannot say. Yeah, thank you.
Okay, thank you, Prof. Rusawa. In Indonesia also, actually several times until now, we still closed our school and university, and then we tried to several times to open the school, but it seems it's not safe yet, and then it's rising the cases transmission in the several district, and then we closed it again. And then maybe before I give Dr. Sudirman to give us also some insight, I have several questions here. This is the first one is from Tao. Tao from, I think Tao is my friend from Kanazawa University in Japan. So yeah, unlike Indonesia, Japan and Australia is facing the second, preparing for the second wave of the COVID-19 now. So what is the explanation or the main reason of the second wave? I think this is for the Australia and Japan's setting, because you have two different two different situation of COVID-19. And another question is from Ganis, Dr. Ganis from Banda Aceh. So yeah, this is about the contact tracing in Japan, because if we see the Japan approach, it's quite different to the other country, because until now the PCR test is still not too high compared to, let's say, Australia or the other country, but Japan is more focused on contact tracing. And how do you explain this? And then this policy? Okay, maybe this is I think we go first to Prof. Anu, please, about the second wave. Okay.
Thank you. So in Australia's case, the second wave started through the hotel quarantine being breached. So remember, I told you that we had very strict border closures. So everyone who came into Australia had to stay in hotels that were in quarantine for 2 weeks. But because there was a breach in the hotel quarantine, in the sense that people who worked in those hotels came into contact with the guests, they took it back to their households, and that's how it spread, the community transmission. So what was being managed in the hotel quarantine was breached, and that once it got out, as Professor Furusawa has shown, it just spreads very rapidly, right? One person can spread to 5 different people, so it quickly spread. So yeah, I think that's the reason.
Okay, thank you very much, Prof. Anu. And then to maybe Prof. Furusawa, about the contact tracing policy in Japan is quite different to the other country. Okay.
Yeah, so yeah, first of all, yeah, I want to talk a little bit about the first question as a reason of second wave. It's because after the end of state of emergency, the people wanted to return to normal life because they are already tired staying home. So, but in this process, still many restaurants and many public spaces are, follow jishuku, that voluntarily limited their operations. However, yeah, firstly, such as drinking bars, pubs, and yeah. So in such places, these small pubs and bars are very small closed environment. That's the factors of 3 C's. But they wanted to return to such socializing social places. Yeah. So the beginning of the second wave was from such places. And another reason is more patient in young generations. So the young generation cannot control their own active behaviors. So that was related to such bars and pub environment. And so this may be related to second question about contact tracing strategy of Japan. Actually, as you know, COVID-19 has a characteristic that the majority of cases are non-symptomatic or asymptomatic. So even if you get even if you got infected, you may feel no symptom you experience. So especially in young generations, many has already infected, but most of them has no symptom. They recognize it. But even non-symptomatic, they can transmit the virus to others. Yeah, so if you feel any symptoms, you may go to hospital and receive the PCR test. But if you do not have such a symptom, nobody wants to, you may not go to hospital for PCR test. So therefore, contact tracing survey and strategy is still under operation. So so health officers, like Puskesmas in Indonesia, we trace back the places and trace to those who are contacted and ask them to have PCR test even without symptoms. Yeah. Thank you.
Hello, Professor Furusawa.
Yes, yes.
Yeah.
Okay. I think maybe Dr. Sudirman, you have to add something here from this 4 questions from the audience. Okay, can you unmute Pak Sudirman, please, for the host? Hello. Okay, sudah. To the host, can you unmute? Okay.
Yeah. Just a very brief addition to Anu and Takuro's explanation. I suddenly remember one thing that also I reckon play a key role in enabling Japan and Australia managing the pandemic relatively well is the solid risk communication performed by the government at all levels, national and sub-national levels. This consistent and firm risk communication enable the society to employ a severe and preventative measures much more consistently compared to sporadic and unstructured risk communication that we face in Indonesia. Contradictory arguments or opinions from government officers at different level of governance are not very prevalent in both countries, even though actually the leader of both countries, the Prime Minister of Japan and Prime Minister of Australia, are categorized as populist leaders. But in the current crisis, both demonstrate their leaning to scientific approach and to consistent risk communication that I think strengthen the perspectives and the awareness of Australians and Japanese society to prepare themselves at individual and family and community level to mitigate the impact. I'm not saying that both countries perform perfect responses, but those 3 or 4 characteristics, state capacity, and science-informed decision-making, political unity, and also consistent risk communication are among other factors that facilitate their relatively well performance.
Okay, thank you very much, Pak Sudirman. I think this is also what determine our approach between this country. And then Pak Sudirman is very well put it in the context that the communication is also very important things. Before I read the other question, I have a question from Anu. Australia is almost, I mean, let's say almost, let's say, control the pandemics, and then we will maybe focus on the economic recovery. And then during this economic recovery, we still have to make the balance between health and also economics, because if you focus into one side, maybe the other will suffer or otherwise. Yeah. So what's the Australia government plan to make the economy recover, but at the same time still control the transmission of the COVID-19? Okay, maybe also I will ask for Furusawa to about Japan's perspective. Okay, please, Prof.
Thank you, Pak. So I think that's a very good question. So there is a lot of tension between the business lobby, which is pushing to open everything, and we also have the lobby with the health lobby, which is saying that no, we shouldn't open everything. So there is a bit of tension there, and it depends on who you speak to. From the government's perspective, I feel that so far the government has done a good job in protecting the lives of people, but I think people are now feeling that it is becoming too much. In the sense, we are seeing this in Victoria. I see that there is a question here. There is a movement of people that are against lockdowns, protest movement starting in Victoria, because they also have very strict lockdowns. They have curfew, they have, and they're being told that till the end of October, they won't be able to go out, or, there are strict lockdowns in Melbourne, so which is our second biggest city. And so we have got that. So in terms of what the government is doing, at this point, I think they're slowly trying to open sector by sector. So the aged care sector, where we saw most of the Australian deaths happening, they are being protected. There are restrictions on young people going there, and they're doing random testing. And there are, so I think in one sense, they're trying to protect the aged care sector. But in the other sense, they're also putting pressure on the states to open the borders. So what is happening is, on the one hand, we are seeing an opening of the economy slowly, and support, but at the same time, they are trying to, see what we can do to slowly bring the economy out of this COVID-induced economic issues. Because I think what we are worried about is we'll come out of this, but we are going to be in a bubble. We're not dealing with anyone from, where there is community transmission. So we have to take steps to ensure that somehow we live with COVID for the next year and a half. And how do we minimize the health risks? How do we protect the economy, but more importantly, protect the health of our vulnerable groups? I think that's what they're doing. It's a hard job.
Yes. And then maybe from Professor Furusawa, you want to add something here? Because Japan also is like the other countries. Have like a very hard impact on economy. Okay, maybe Prof. Furusawa.
Yeah, but actually this has a severe impact on economy of Japan. So that's the reason why, because even the coronavirus not totally eliminated Japan, but Japan restarted economic activities. And but actually, economic package of Japan for the COVID-19 for this year is, 1 year, but economic stimulus plan for this 1 year is bigger than total budget spent for 9-year recovery from 2011 Tohoku earthquake tsunami. But yes, and another point is that Japan has very big governmental debt. So Japan's financial situation is so bad. So Japan has about 3 times government national debt, 3 times of Japan's national income. So the Japan is in the worst situation of the economic condition in the world, even before the time of COVID-19. But as Dilma suggested, that today's government is like a little bit like populist leaders, and so that the leaders spent a lot of money for make people, citizens enjoy it without thinking about future of the Japanese financial situation. So yeah, so I cannot expect the future, but the future financial situation may be very maybe a tragedy for Japan. Thank you.
Okay. Okay. Thank you very much. We have also several questions. This is maybe a little bit more specific. There is a question from the Dr. Wayan Juliarsa from Palopo regarding the how did Japan and maybe also Australia prevent or reducing the health workers cases, because in Indonesia for the COVID-19, because Indonesia we see that there are so many health workers, doctors, and also nurses is died because of these diseases. And the second one is regarding the public education from the government. The question is from the Dr. Tendriagi Malawat. Is there any, what is it, people in Australia or Japan is not believe in COVID-19 and then make like opponent movement to the health policy from the government? I think this is maybe who Prof. Frosa or Prof. Anu? Prof. Anu?
Okay, thank you. Thank you. So good question again. So what we do see is in terms of public education, the government had a lot of messaging about social distancing, how to wash your hands. That type of message is constantly being shown on TV. It's shown on, lots of signs everywhere. And we also have what they called a contact tracing app. They asked everyone to download the app. So there is a lot of messaging about public education on contact tracing, on social distancing, wearing masks in public areas, particularly in hotspots. But as you said, there is a big movement growing increasingly, which is against lockdowns, but which is also against vaccinations. There are some people that have an objection to vaccinations. There are, that is also another challenge. I would say that it's a very small minority. It's not a big group of people. With regards to your other question about health workers being affected by COVID, we also had that situation here. We had health workers who are affected by COVID, but luckily they have not, been badly affected, but they did get COVID. We do have lots of examples of that. Yeah.
Okay. So, Prof. Ano, so I think we have a same challenging also between Indonesia and Japan regarding this public education. But I want to add something here. How do you make sure that the people is follow the health authority, health officer regarding the the health protocol for the COVID-19?
So in areas where they have the restrictions, sorry, did you finish the question? Or?
Yes.
Yeah, so in areas where there are restrictions, we actually have the police walking around, and there are severe fines for, violating the restrictions. And maybe, in Melbourne, for example, there have been arrests and so on. So yeah, there are severe fines for violating restrictions. Or even have people that try to escape from the quarantine hotels. They have been fined. Yeah, so it's strong penalties for violation of the restrictions.
Okay, thank you very much, Prof. Anu. To Prof. Furusawa, maybe this is also the question because Japan has a little bit soft approach. There is no mandatory, mandatory for people to follow the health policy, but people in Japan is follow the policy. How do you explain that? And also regarding the previous question about is there any other movement that's is an opponent for the health protocol for the COVID-19? Okay. and
Yes,
also the
yeah, question. So regarding question about health workers, actually, health workers are faced with very, how to say, tough situations. And yeah, as I said, the government of Japan tried to avoid collapse of medical services. And however, in some cases, especially in the time of first wave, in some parts, in many places, yeah, actually, collapse of medical services happened. And yeah, but yeah, and also health workers are faced with discrimination in such a Japanese society. So those medical doctors, nurses may be infected with the virus. So yeah, children of such medical workers are also, even small children are faced with discrimination in their school, in some news said. So the way the government and media tried to make images that such health workers are heroes of society to avoid. Maybe that is one public education. And yeah, but actually, and another message for the government is don't go to hospital. Because the hospital is one potential place source of the cluster, and the medical resources are limited. The government says even if you get any sickness, please don't go to hospital. So yeah, maybe that was successful to avoid severe collapse of medical services. However, since that, so actually, patients, the number of patients other than COVID-19 dramatically decreased. So now is the season for other virus infections such as rotavirus and other infections, but almost no patient in because those patients do not want to go to hospital. So as a result, so most of the hospital or medical workers lost their source of income. So yeah, so maybe that is also another tough time. So many of medical professionals lost their work and lost of their source of income as a side effect of the COVID-19. Yeah.
Okay, before I give also a chance to Pak Sudirman to give us some insight, there is one question to Prof. Anu here from Ibu. What is it? From Ibu Novi Manurung, yeah, to Prof. Anu. Yeah. You already read the question?
Yeah, I replied in the chat.
Yeah. Okay. So what is your suggestion and also your advice for us? Because yeah, compared to Australia, Indonesia is very big.
Yeah, I think it's a really good question, and it's hard one to answer, right? I think basically doing a lot of testing and contact tracing is the way to go. But I think for me, like one good example is Vietnam, right? Vietnam has managed to have a big population, very low cases, and a developing poor country, right?
Yeah.
So I think, if you see that, compare Vietnam and compare the US, which is a rich country, we can see that you don't need a lot of money to manage this. What you need is discipline and being able to do a lot of testing, having PPE equipment available, and contact tracing, and having the capacity in the health system. So
yeah, okay. This is for Ibu Novi, and then I think we're still struggling with this how to manage the COVID-19 because our number of testing is also compared to the other country, compared to the total population is still quite low, and also the contact tracing also become one of the tough task force us to to look for the cases, and then okay, maybe I will invite Pak Sudirman. You want to add something? Okay.
Yeah, thank you, Dr. Joko. I think the last part of
okay, it's unmute again. Okay.
Yeah, I think I will echo the last part of Professor Ratmohan's explanation about the urgent need to strengthen the health system. And this is not just about the amount of money, but actually also how to invest in more strategic ways. Some countries in Southeast Asia, such as Vietnam and Thailand, and also Malaysia, despite their capacities, including economic capacities, of course, are much lower compared to Australia or Japan or the US, but they manage also to perform relatively well. And their economic circumstances are more closer to Indonesia's circumstances. So sharing a lesson learned from each countries will be crucial to enable countries in the region or to enable countries in the world to tackle the pandemic or to get prepared for the next pandemic, because there's no guarantee that this is the last pandemic that we will face in our lifetime.
Okay. Okay. Thank you very much, Pak Sudi. And then now maybe we will make some, let's say, conclusion for our webinar this afternoon. So before we end our webinar this afternoon, I would like to invite if Prof. Purusawa or Prof. Anu maybe still have a what is it, like a closing speech for us, because what we want from our webinar this afternoon is we are not only want to know how Australia and Japan manage their pandemic situation, but also how we use this knowledge and experience to prepare our society to be resilient for the next pandemic, as Pak Sudirman Nasir say. Maybe I will go first to what is it, Prof. Furuzawa. Prof.
Yeah.
Furuzawa Sensei. Okay.
Yes. Yes. Thank you very much. Yeah, this is my great experience to share our knowledge and to learn a lot from you. Actually, I just reminded when I first visited in Makassar for explore any potential of the research collaboration, but at that time I searched any where there is PCR analysis available, but this is very limited in Makassar. So I imagine that I know some technicians, some researchers in Unhas who are professional about PCR. So maybe they are very busy and have faced with the tough condition today. So I just want to cheer them up even during tough time. And also my another message is as the same as my last message in my presentation. So to keep collaboration and enhance internationalization even in this tough time. So we are more scientific collaboration or academic exchange maybe can be lead to better preparedness for further future potential pandemic. Yeah, thank you very much.
Okay, thank you very much, Professor Furuzawa. And maybe from Professor Anura Mohan.
Thank you, Pak. So so I just want to say thank you again for inviting me, and it was good to share my experience and also to hear from Prof. Furusawa about the Japanese experience, and also Sudhi for the connection with Indonesia. So you're absolutely right. This pandemic has shown us that we all face common problems and we can work together to solve these problems. So from our perspective, we are already working with UNHAS on the Australia-Indonesia Center Collaboration Project. We're also look forward to working with you on other joint programs for our master's programs, and for maybe we can look at joint PhD cooperation or research collaboration, and we are very happy to collaborate with UNHAS. I think we are just looking at signing the document at this point, so we are excited about this. Yeah, thank you.
Thank you very much from Professor Anu Ramohan, and I hope also that the collaboration between UNHAS and Kyoto University and the University of Western Australia and the other institution in Japan and Australia is still last and longer. And then maybe for the last speakers, I will also invite Pak Sudirman Nasir to give us some the closing comment for our webinar today. Before I invite Professor Nasrum Masti to close our webinar this afternoon. Okay.
Yeah, thank you, Joko. I think my final comment is to see how Australia and Japan as countries now facing aging population in combination to the COVID-19 emergency. And even though Indonesia's life expectancy is lower compared to Australia and Japan, but we are steadily also moving into aging population which is more susceptible or prone to non-communicable diseases. Many of them are important comorbidities in relation to COVID-19. So learning from each other, learning from both successes and also shortcomings, I think is very important, and we can do that through research and academic collaboration that so far are running very well between Universitas Hasanuddin and the University of Western Australia and also Kyoto University. And we are very fortunate to have Professor Nasrum, the Deputy Director in International Collaboration, who will also provide a closing speech and also, of course, encouraging partnership between universities in the region. Thank you, Joko.
Okay, thank you very much, Pak Sudirman. And then I think, our time also is very limited for this webinar. So I would like to invite Prof. Nasrum to give us some insight here, speech, and also closing our webinar today. So Prof. Nasrum, Professor Nasrum. Okay.
Thank you very much.
Thank you very much, Prof.
Can you hear me?
Very clear.
Yes. Yeah.
Hello, Dr. Joko?
Yeah, Prof.
Can you hear me?
Yeah. Kedengaran, Prof. Ya,
Okay,
jelas.
okay. Yeah, thank you very much. And Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody, especially our special guest, Professor Anu Ramohan from University of Western Australia and Professor Takuro Furusawa from Kyoto University. I'm a Vice Rector for Research Innovation and Partnership from Hasanuddin University. My name is Muhammad Nasrum Masi. Actually, I'm graduate from Kobe University in the medical faculty. Especially my specialty is clinical microbiology, and I'm arranged one laboratory for diagnostic swab test in Hasanuddin University Hospital. Thank you very much for this nice discussion related with the COVID-19. I think there's many benefit for us as a university. Even actually we already arranged this kind of the same topic related with the COVID-19 lesson learned from the Netherlands, I think. Now we have another from another country, Australian and Japan, and the topic related with the science, society, and government policy aspect. I think this is very interesting, and hopefully that in between UNHAS and Australia and Japan, we can increase our collaboration related with the especially for the COVID-19 or another topic, I think. So in Indonesia, as you know, that we have the same how to protect from transmission of the COVID, like use hand washing and use face mask and social distancing. And for government policy in Indonesia, that they recommend us to do it a lab swab test, to increase a lab test swab. And until now, according to the more than 200 laboratory in Indonesia, we just cover every day around 30,000 until 40,000 tests per day. So not like in Japan, maybe in Australia, maybe more than 1 million every day, as I know. So that's why we need to increase that. And besides that, contact tracing and isolation of the patient or suspect in the hotel or quarantine, this is okay. So on behalf of university, I think Hasanuddin University, we really thanks to Professor Ramohan and Professor Fursawa for this to sharing your knowledge and experience related with the COVID-19. So we hope that not only in this time, but hopefully that Dr. Sudirman and Dr. Joko can enhance to maybe make it like a article in a review related with how the three countries can manage the COVID pandemic COVID in its country. So it means that this is the beginning of our collaboration, that we can write the paper in maybe in journal for the mini review related with that. Maybe there is a specific method or government policy related with that. So I hope that this is still continue our collaboration, and thank you very much for all of your information. And thank you very much for the steering committee and Dr. Joko and Dr. Sudirman for arrange this webinar. So let's close this webinar together with Alhamdulillahirabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. So thank you very much for all the speakers, to Prof. Ramohan, Prof. Fursawa, Pak Sudirman, Prof. Nasrum, and all the participants. I think our discussion this afternoon was very fruitful. And then, Indonesia, we learned a lot of so many things from this Japan and Australia experience on this pandemic situation. And then, in Indonesia, we need all the assistance to help us contain the transmission of the virus, and also to increase our capacity, and also how to help us recover the economy. And then there are several things that I think I must stress in this webinar is the capacity of the government, the capacity of the society must be addressed very well. And then also the science-driven policy. So this is also we need to improve it in our country, in Indonesia. So I think this is the last. So hopefully the COVID-19 soon will be relieved, and we found the vaccine as soon as possible. And then yeah, we can be more stronger for the other pandemics in the future based on our knowledge and experience for this current pandemic situation. And to the all participants, wherever you are, stay safe and healthy. And thank you very much. See you for the next events. Goodbye from Makassar, and Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for Pramohan and for Furusawa. Arigato sensei.
Thank you, Joko. Thank you, Anu and Takuro-san.
Thank you.
Thank you.
Bye.
Thank you very much.
Thank you. Bye.
Terima kasih banyak, Pak.